What is an endoprosthesis, or allograft for bone cancer? Imagine having a part of your bone removed because of a tumor, and then needing something to replace it so your limb can stay strong and functional. That's where endoprosthesis and allografts come into play. These are two main options surgeons use after removing cancerous bone tissue to help rebuild the structure and restore movement. An endoprosthesis is like a custom-made metal replacement for the bone or joint that was taken out. It is usually made of durable metals like titanium or cobalt-chromium alloys. The prosthesis is shaped to fit where the tumor was removed, often replacing parts of long bones like the thigh bone or upper arm. It is fixed inside the remaining bone, providing immediate support and allowing patients to start moving sooner after surgery. Endoprostheses are especially useful when the tumor involves a joint, such as the hip or knee. They tend to have low early complication rates, but over time, some issues can develop, like the implant loosening or detaching from the bone, which might require further surgery. On the other hand, an allograft involves transplanting bone tissue from a donor, usually a cadaver, to replace the bone that was removed. This biological graft acts as a scaffold, giving the patient's own bone cells a chance to grow into it. Allografts can include entire joint surfaces or segments of bone, and they are often used in younger patients because they help preserve the natural bone structure. The goal is for the transplanted bone to integrate with the patient's own tissue, restoring stability and function. However, allografts come with risks like non-union, where the graft fails to fuse properly, infection, or degeneration of the joint over time. Sometimes, surgeons combine these approaches in what is called an allograft prosthetic composite. This technique uses a donor bone along with a prosthetic implant to get the best of both worlds, biological integration and mechanical strength. It can improve muscle attachment and overall function but may take longer to heal and carries additional risks related to the graft. Choosing between an endoprosthesis, an allograft, or a combination depends on many factors. These include the patient's age, the location and size of the tumor, how long they are expected to live, and their personal goals for mobility. For example, younger patients might benefit more from an allograft to preserve bone for future surgeries, while older patients might prefer an endoprosthesis for quicker recovery and immediate stability. In summary, an endoprosthesis is a metal implant that replaces the removed bone or joint, offering durability and early mobility but with some long-term risks. An allograft is donor bone tissue that can grow into the patient's own bone, helping restore natural structure but with potential complications like non-union or infection. The combined approach aims to maximize function and stability but involves longer healing times. These options are vital parts of limb salvage surgery for bone cancer, designed to remove the tumor while keeping as much limb function as possible. The best choice depends on careful surgical planning and individual patient needs, with ongoing monitoring to manage any complications and ensure the best possible outcome. Always consult with a healthcare professional to determine the most suitable treatment plan tailored to your specific situation.